The Ontario government is announcing plans to expand the number of procedures that happen in community and surgical diagnostic centres. Richard Southern is in Mississauga, where the health minister spoke today. But Richard, you've been chasing a response from the government to your reporting on ServiceOntario. Tell us a little bit about that, and did you get a response from the government today?
Not quite. We did hear some new information, though, on this, or a new claim at least, Karen. As CityNews has been reporting for days now, the Ford government is shutting down 11 privately run ServiceOntario outlets. These are run by small businesses. Some of them have been family-owned for decades. The government's moving them into Staples and Walmart, and taxpayers are paying those U.S. retail giants to retrofit the stores. Staples admits it's looking to make money off of this. I asked the Deputy Premier here today how many taxpayer dollars are going to Walmart and Staples and why these deals were sole sourced. Take a look.
That program is going to save taxpayers $1 million every year, year over year. We are offering more convenience for individuals who want to and need to use the services of ServiceOntario. I remember, and I'm sure many of you remember, the long, long wait times and the long lineups that we had to endure at our ServiceOntario facilities. We are making it more convenient.
So no answers to my questions on how many taxpayer dollars are going to these wealthy retail chains. No answer on why it was sole source. But for the first time, the government's claiming this arrangement will save $1 million. We'll certainly follow up with them on that. As for why the health minister was here, she was announcing more private surgical and diagnostic clinics in Ontario. More of them will start to be rolled out in the spring. Important to note, these are OHIP covered. So, you know, bring your OHIP card. It's covered under OHIP, but certainly critics have taken issue with the government's expansion of these private clinics. The government, though, contends it'll reduce wait times. ER wait times was the other big issue. They are at historic high levels, emergency room wait times in Ontario. We asked the health minister what she's doing about it, and she kind of just reiterated a lot of the investments the government has already made. She also didn't release what the current January average ER wait times are. Karen, the latest data we have on ER wait times is from November, and it showed them approaching historic high levels, with the average patient waiting more than 22 hours to get admitted to the hospital from the ER.
Yeah, and Richard, you asked if the government will release those current wait times. No commitment?
No commitment. Sylvia Jones's office later clarifying that they're not their numbers to release. It's certainly something we'll follow up on. The government has contended that ER wait times are the lowest in Canada in Ontario, but again, all the doctors we've been talking to on City News are saying this is the worst wait times we've ever seen in our career right now, Karen.
Okay, Richard, we'll leave it there. Thanks so much for your reporting. As always, that's City News' Richard Southern in Mississauga.
Thank you.